Hi, I'm Michael from Planet Naturopath, and this video today is about acid reflux or heartburn. A lot of people think that acid reflux is caused by too much stomach acid, and this makes sense because it's the stomach acid coming from the stomach up into the esophagus to cause that burning sensations. But it's actually not caused by too much stomach acid. You can see from this graph here that stomach acid actually peaks around 20 years of age, and there's a steady decline as people get older. So you would expect that if stomach acid was the main cause of acid reflux, that it would be mainly affecting people in their 20s and 30s, and incidences of acid reflux would decline as people get older. But that's not the case. Acid reflux is quite rare for people in their teens and 20s, and usually only starts to occur when people hit in their 30s, 40s, and then gradually gets worse as people get older. There are a couple of other reasons behind this, like people getting more overweight, stomach infections, but it's definitely not an excess of stomach acid causing acid reflux. So if you go to your doctor with acid reflux, you're normally given what's called a PPI medication. This is a proton pump inhibitor, like Nexium, Losec, Somac, Pariet. So these drugs lower the stomach acid, so you don't get acid reflux. And so while this might be a good thing, these acid reflux medications have a lot of side effects. Acid reflux medications like Losec, Nexium, and Pariet are only meant for short-term use when you're treating an ulcer or there's some type of gastritis happening. But many people are on these drugs for years. So the side effects of long-term reflux medication can include poor calcium absorption, which can lead to osteoporosis. There's an increased risk of heart disease, increased risk of kidney disease, increased risk of gut infections. Your stomach acid that it's lowering plays an important part in stopping your body from getting infections. There's also poor nutrient absorption like B12, zinc, iron. So this can have an effect on all aspects of your health. So if it's not too much stomach acid causing acid reflux, and if the PPI medications are only addressing the symptoms, what actually causes acid reflux? The lower esophageal sphincter stops the contents of the stomach from rising back from the stomach up into the esophagus. The stomach is meant to be very acidic to help digest the foods. You're meant to have stomach acid. And it's actually not too much stomach acid that causes this acid reflux, but a weakening of the esophageal sphincter. This diagram explains how acid reflux occurs. So it's actually not too much stomach acid that causes acid reflux, but a weakening of the lower esophageal sphincter, or LES. Your stomach is supposed to have plenty of stomach acid and gastric juices to help digest the foods and absorb the vitamins and minerals from these foods. And it's a weakening of this sphincter muscle that allows the stomach acid to rise back up into the esophagus. And you only need a very small amount of acid to rise back up to cause that heartburn, acid reflux feeling. Or in some cases, some people don't get that burning sensation, but they have that feeling that need to clear their throat or having a dry cough. And this can be caused by the very small amount of acid causing a buildup of mucus. And this is known as silent reflux. So things that can weaken this esophageal sphincter are weight, being overweight, overeating, lying down after meals, or even a lack of stomach acid. So the food just sits in the stomach and doesn't digest properly. But the number one cause of this weakened lower esophageal sphincter is bloating. So how do we stop bloating? Well, the first step is to identify the cause. Find out if it's a bacterial infection like Helicobacter, SIBO. Look at food intolerances like fructose, gluten, lactose. But it's these gases caused by the bloating that weakens the lower esophageal sphincter, or LES. So the first step is to identify why someone's getting bloated and then address the cause. And sometimes I talk to clients and they say, I don't even feel bloated. But when I modify their diet, make some changes, and they report back to me 2 weeks later, it's like, wow, I feel so much less bloated. And this is because they've felt bloated for so long it becomes the new normal. One of the most common causes of bloating, reflux, and IBS symptoms is infections that can occur either in the stomach or the small intestine. Helicobacter pylori is a bacteria that lives in the stomach. And the way it survives in this very acidic environment is it lowers your body's ability to produce stomach acid. And it's this low stomach acid that causes the bloating and pressure on the lower esophageal sphincter, leading to acid reflux. The other infection is small intestinal bacterial overgrowth, also known as SIBO. You're meant to have trillions of bacteria in your large intestine, but very few in your small intestine. And it's these bacteria that can get into the small intestine that produce gases called methane and hydrogen. And it's these gases that cause the bloating and puts the pressure on the LES to cause acid reflux. So there's a lot more to treating your acid reflux than just taking a medication for the rest of your life or going on a restrictive diet. The first step is identifying if you have an underlying bacterial infection like Helicobacter or SIBO that's the main trigger behind your symptoms. The next step is to follow a low FODMAP diet to see if this can also help in the short term to identify what foods may be a trigger. And finally, there's some supplements like digestive enzymes, in particular betaine hydrochloride and pepsin, that can actually help stimulate and make more stomach acid for you. I see this as a short-term solution while we identify the underlying cause. If you need more help, go to planetnaturopath.com and we can help you with testing, dietary guidelines and advice to get you back on the right track.